Hi, this is David Greene with the Florida Pain Network, where we connect those in pain with the best pain relievers in the state. And that includes chiropractors, pain management doctors and clinics, and physical therapy practices. Today the topic is facet injections. What are they? Who gets them? How well do they work? Well, a facet joint, and I brought a visual aid here today, here's the spinous process of someone's back, here and here. Those are the bumps that you can feel on the back just above the skin. These are the transverse processes coming out, those you cannot feel. And where the two levels of the vertebrae connect is called a facet joint. And those can develop arthritis just like any other joint in the body because they all have cartilage. So your knee has cartilage, you start to lose it, you can get arthritis and pain. No different than the facet joints. What is different is that there's one at both sides of the spine all the way up and down. So you have them in the neck, the thoracic spine, and the lumbar spine. And if you start to develop arthritis in one of them, you may develop arthritis on both sides and multiple levels. So surgery is not a great idea. There does not exist a very good facet replacement like you have for a knee replacement. I mean, knee replacement, hip replacement, those are two out of the top 5 best quality of life procedures in the world, in all of surgery. Not so for facet surgery, all right? So they're about the size of a thumbnail, and there's one on each side, like I said, at every level. What are the treatment options? Well, it's very common to get facet arthritis, and thankfully there are good non-operative treatment options in the world of pain management. So you have, anti-inflammatories, Tylenol, chondroitin, sulfate and glucosamine, or you can get any health food store or grocery store. Then you move into things like chiropractic and physical therapy and spinal decompression therapy. But what we're talking about today is facet joint injections. So when you see on the drawing here the facet joint, just like an injection into the knee, your hip, your shoulder, a pain doctor can do an injection right into that joint. And they do that utilizing a machine called fluoroscopy, which is a real-time X-ray machine. And it allows the doctor to be precise about where the needle is placed. And they numb up the skin and the soft tissue is going down to the joint. And typically they'll inject some numbing medication along with a steroid. And it usually works pretty well for a few days, few weeks, few months. It's variable, anytime in between. All right? So that's the first type of injection. And that can be done multiple times per year. The second type is called a medial branch block. It's a fancy term, but basically what it refers to is the needle does not go into the joint. It goes into the area around the joint, and it numbs up the medial branches, the tiny little nerve endings that are coming in and supplying sensation to the joint. Joints have sensation. Your knee joint has little nerve endings coming in, bringing it sensation. So does your hip. Everyone does. And if you're diabetic, for instance, you may end up having those nerve endings die from diabetic neuropathy or whatnot, and the joint may feel no pain. Not the best way to treat arthritis, by the way, but it would work. Anyway, so what you can do, a pain doctor can inject numbing medicine and steroid into the area around the joint, but not into it. All right? And that's called a medial branch block, and it can give pain relief for days to weeks to months. And that can also tell the pain doctor that that facet joint is causing your pain. So it serves a diagnostic purpose and a therapeutic purpose. If it wears off and then the pain comes back, the question is, what do you do then? Well, you have a few options. One is do nothing. That's always an option. The second one is to get it done again. Medial branch block or an injection into the facet joint itself. But another option, which has become very popular in the last 10 years, is called radiofrequency ablation. And that involves a needle, and I circled here because the facet joint is here, and then in the medial branch area, that's where the needle goes. It gets heated up at the end of it, and it deadens those nerve endings for up to 18 months. Some studies showed up to 2 years. But it's a long-term answer to facet arthritis that can be extremely beneficial in avoiding surgery. Eventually those little nerve endings will grow back and the pain may come right back with it, but it can be repeated. So it's not like it comes back and you're doomed. Okay, that can be extremely helpful, is just to get it done again. So that's an overview on facet joint injections, medial branch blocks, and radiofrequency ablation. Check out our website at floridapainnetwork.com. Lots of education on there, very active blog. As you can see, we have an active YouTube channel as well. And if you're looking for a pain clinic or a chiropractor or a physical therapy practice, type in your city or your zip code and geographically targeted results pop right up. I'm David Greene, Florida Pain Network. Your pain stops here.